Hi, hello, good morning, friends. Welcome to our channel, The Voice of Nurse. Today we are going to discuss a continuous topic from the previous video, child health nursing. In this video, this is part 4. We are going to discuss 20 questions in this video from the 80 to 100 questions. Means 20 questions we are going to discuss in this video. In previously, we already finished 3 parts related to the child health nursing. In part 1, we discussed related to the introduction of the child health nursing and some of the introduction related to the child health nursing disorders also, plus 20 questions we discussed in part 1. In part 2, we already discussed from the 31st question to 50 question. 30 question we discussed in part. In part 3, we discussed related to the question number 50 to 80. We covered 30 questions in part 3. Now we are going to discuss part 4 today. Before moving on to topic discussion, a small request, friends. Anybody watching first time my channel, please subscribe my channel and click on the bell icon for further notification. Please like a video, share your opinion in comment section, and please share this video to your friends. Let's move on to topic. Today we are going to discuss part 4, question number 81 to 100 question. 20 question we are going to discuss in this part 4. 81 question. The neonate stomach capacity is about. The neonate stomach capacity how much? We will see here options. Option A 105 ml, option B 40 ml, option C 90 ml, option D 200 ml. At birth, baby's tummy is no bigger than a toy marble. By day 10, the baby or neonate. By day 10, the stomach grows to the size of ping pong ball size. By the second day, baby stomach will be about size of a cherry. Baby will be able to take in a little more milk with each day. Day by day, the stomach capacity will increase in neonates, because first day it will be in 7 to 10 ml of capacity. In second day, it will be 10 to 20 ml of capacity. But here in this question, neonate stomach capacity is about how much? Here option C 90 ml is the correct answer. In day 1 5 to 7 ml, day 3 20 to 27 ml, day 7 or first week it will be 45 to 60 ml, and after the 1 month it will be 80 to 150 ml of feed we can provide the neonate baby. The newborn stomach capacity day by day automatically grow up. So here neonate stomach capacity is 90 ml. Next we will move on to question number 82. Which of the following the complication of phototherapy? Which of the following the complications of phototherapy? We will see here options. Option A hypothermia, option B decreases HB hemoglobin, option C bronze baby syndrome, option D all of the above. Phototherapy. What is phototherapy? We already discussed in previous videos related to the phototherapy. Phototherapy, we will provide a newborn babies for treating a jaundice or hyperbilirubin in the body. So here complications of phototherapy means we will see what are the complications will come under the phototherapy. Overheating, diarrhea, illness, rashes, retinal damage, temporary lactose intolerance, and bronzing of neonates. So here we got a option C here, bronze baby syndrome. What is bronze baby syndrome? We will see now. Bronze baby syndrome is a rare complication of phototherapy for neonatal jaundice occurring due to the modified liver function, particularly cholestasis of various origins. Here what is cholestasis? Cholestasis is an condition in which the flow of bile from the liver spots or slows. So bile is in digestive fluid, it means cholestasis. But here in these options, bronze baby syndrome is there. This is the complications of phototherapy. In this situation, no treatment is required for the bronze baby syndrome as a pigmentation slowly disappears after the stopping the phototherapy. Usually, some babies can develop a dark grayish brown discoloration of the skin and urine or bronze baby syndrome. It is not harmful and gradually goes away without treatment after the several weeks. So here in this option, bronze baby syndrome is the complications of phototherapy. Next we will move on to question number 83. Immature cardiac sphincter and esophageal cause are in the newborn or babies. Immature cardiac sphincter and esophageal cause means what is the immature cardiac sphincter and esophageal causes from the options. Option A diarrhea, option B constipation, option C regurgitation, option D chest pain. If the sphincter does not close properly, food and liquid can move backward into the esophagus, and the main cause for the sphincter immature development is regurgitation. The action of bringing swallowed food up again to the mouth is called as regurgitation. What is the cause of regurgitation? Regurgitation happens when a mixture of gastric juices and sometimes undigested food rises back up the esophagus and into the mouth. In adults, involuntary regurgitation is a common symptom of acid reflux and GERD. It may also be symptom of rare condition called as rumination disorders. The causes a weak cardiac sphincter is like blood pressure, medication, sleeping pills and sedatives using, and antibiotics and antidepressants, iron and potassium supplements due to proton pump inhibitors all cause damage to the lower esophageal sphincter. Due to this, the cardiac sphincter will immature here. So, immature cardiac sphincter and esophageal cause is option C, regurgitation is the correct answer here. Next, we will move on to question number 84. Hyperbilirubinemia is also called as the other name of hyperbilirubinemia. We will see here options. Option A spasticity, option B icterus neonatum, option C hypertonia, option D nystagmus. First here what is hyperbilirubinemia we will see now. Hyperbilirubinemia is a condition in which there is too much bilirubin in baby's blood. When red blood cells break down, a substance is called as bilirubin is formed. Babies are not easily able to get rid of bilirubin and it can build up the blood and other tissues and fluids of baby's body. So if bilirubin level is high in the body means we all know it will be called as jaundice. But here in this option jaundice is not there. We will see one by one what is these all are options. First we will see spasticity. Spasticity is a condition in which there is a abnormal increase in muscle tone or stiffness of muscle is called as spasticity. So here bilirubin levels is high means hyperbilirubinemia. Other name is not spasticity. Next we will see option B icterus neonatum. Hyperbilirubinemia or jaundice in a life threatening disorders in newborn. In medical term, the jaundice in babies is called as neonatal jaundice. It is also called as icterus neonatum. In neonates, the jaundice is positive means it is called as icterus neonatum. The icterus neonatum is taken to mean the presence of clinical jaundice in infants during the first 3 to 4 weeks of life. It is called as icterus neonatum. So here hyperbilirubinemia is also called as icterus neonatum. Here option B is the correct answer. Next we will move on to question number 85. Nurse administer vitamin K injection to newborn for. Why we are giving a newborn baby for vitamin K injection to the newborn babies? Here nurse administer vitamin K injection to newborn for. We will see here options. Option A immunity, option B prevents infection, option C prevents bleeding, option D prevents jaundice. Vitamin K helps babies' blood to clot. Babies need more vitamin K than they get from their mother during pregnancy or from breast milk. Parents of all newborns are offered a vitamin K injection for their baby soon after the birth. This helps prevent babies from the become vitamin K deficient. Low levels of vitamin K can lead to dangerous bleeding in newborns and infants. The vitamin K given at birth provides protection against bleeding that could occur because of low levels of this essential vitamin. Vitamin K injection to newborns for prevents bleeding. It is very important that all babies get a vitamin K shot to prevent vitamin K deficiency bleeding, and here option C is the correct answer. Next we will move on to question number 86. Weight velocity in girls is greatest during. Weight velocity in girls is greatest during the which period of the time? We will see here options. Option A 2 to 5 years, option B first 2 years of life, option C 10 to 13 years, option D none of the above. Here what is weight velocity? Weight means we know. What is velocity? Weight velocity means velocity stands for weight are presented as 1 month increments from birth to 12 months and 2 to 6 months increments from the birth to 24 months. It means particularly useful for the lactation management purposes or presented in first week and second week intervals from the birth to 60 days. The growth velocity or weight velocity in children's yearly it is different, but here weight velocity in girls is greatest during the first to 2 years of life. Here option B is the correct answer. Next we will move on to question number 87. Vaginal bleeding of the newborn is called as. In some newborn babies, vaginal bleeding will present. The vaginal bleeding of newborn is called as in medical terms. We will see here options. Option A, mastitis neonatum. Option B, erythema toxicum. Option C, pseudomenstruation. Option D, none of the above. Here option A, mastitis means related to the breast. Erythema toxicum means it is a rashes or red rashes. Skin allergy means it is related to the skin. Here option C, pseudomenstruation is the correct answer. Vaginal bleeding is also called as at the newborn babies is also called as pseudomenstruation. Sometimes newborn girls may have a small amount of vaginal discharge, a thick white mucus that may sometimes be tinged with blood. This is called as pseudomenstruation and happens because baby is no longer getting your hormones through the placenta. So here the causes for the pseudomenstruation is baby is not getting any hormones through the placenta. It can start any time from the 2 to 10 days of newborn babies. This is normal and called false menses also. The causes is the sudden drop off in the mother's estrogen after the birth. So here option C is the correct answer, pseudomenstruation. Next we will move on to question number 88. What is the other name of congenital club foot? What is the other name of congenital club foot? Here we will see options. Option A, talpes valgus. Option B, talipes equinovarus. Option C, talipes. Option D, talipes varus. Club foot, also known as talipes equinovarus. So here option B is the correct answer. In detail we will see now. Talipes equinovarus is a common foot abnormality in which the foot points downward and inward. Talipes equinovarus is a specific and common type of what is sometimes is called as club foot, a term that encompasses a range of abnormalities of a ankle or foot present at the birth. The early treatment should correct it. In club foot, one foot or both feet point down and inwards with the sole of the foot facing backwards. So here option B is the correct answer. Next we will move on to question number 89. Depression of Fontanelle indicates. Here the child is having depression of Fontanelle that indicates to. We will see here options. Option A, decrease ICP means intracranial pressure. Option B, increase intracranial pressure. Option C, dehydration. Option D, hydrocephalus. A tense or bulging fontanelle occurs when fluid builds up in the brain or brain swells, causing increased pressure inside of the skull. But here in this question, depression of fontanelle is there. A sunken fontanelle, when accompanied by other symptoms, can be sign of depression or malnutrition. Some babies' fontanelle always appear slightly sunken even when they all well. Sometimes a baby is dehydrated but does not have sunken fontanelle. So here depression of fontanelle is indicates to that child or neonate baby is having dehydrated. Dehydration is the correct answer here, option C. Next we will move on to question number 90. Bladder capacity of neonate. What is the bladder capacity of neonates? We will see here options. Option A 20 ml, option B 15 ml, option C 10 ml, option D 25 ml. The newborn bladder has a predicted capacity of approximately 20 to 30 ml. Infants typically urinate 15 to 20 times per day. The urine varies in color from nearly clear to dark yellow. The neonate's bladder capacity is approximately 15 ml to 20 ml is the correct answer. But in neonates, the bladder capacity, in newborns is different and neonate is different. Day by day, the bladder capacity also will increases. So here option B 15 ml is the correct answer. The bladder capacity of neonate is 15 ml. Next we will move on to question number 91. Pyoderma is caused by. What is pyoderma? What is the causes? We will see. Before that we will see here options. Option A streptococcus. Option B staphylococcus aureus. Option C staphylococcus pyogenes. Option D all of the above. Pyoderma. Pyoderma is a skin infection with formation of pus. A chronic or recurrent skin disorder in which small or discolored bumps or blisters appear on the skin that can rapidly grow and joined together become large open sores. It is also ulcers formation. The number of ulcers can vary. So pyoderma means a skin infection with formation of pus. What are the causes? We will see now. Exact causes of pyoderma is unknown. The condition is not infectious or contagious. It often associated with autoimmune disorders such as ulcerative colitis, Crohn's disease and arthritis, and it may have genetic component also. Usually recurrent primary pyoderma are common in school children, whereas recurrent secondary pyodermas may be seen associated with atopic dermatitis and popular urticaria in preschool children. Personal hygiene is one of the important factors, especially in children. Exact cause of pyoderma is unknown. Most common organism usually isolated in pyoderma is Staphylococcus aureus. Here option B is the correct answer, which may either methicillin sensitive or methicillin resistant. MRSA is important healthcare associated pathogen. So here option B is the correct answer. Next we will move on to question number 92. Knock knee is otherwise known as. What is knock knee? Otherwise knock knee is called as. We will see here options. Option A osteomalacia, option B club foot, option C genus valgum, option D none of the above. Knock knee is a condition in which the knees tilt inward while the ankles remaining spaced apart. The condition is slightly more common in girls, though boys can develop it too. But knock knees is also called as genus valgum. Not only knock knee is also called as genus valgum, knock knee is also called as knock knee deformity, knock knee syndrome, knocked knee or Genu valgum. These all are the other names for the knock-knee. But in this option we are having genus valgum is also called as knock-knee here. Knock-knee is common in children aged of 3 to 6 years of children will get more affected with knock-knee. Here option C, genus valgum is also called as knock-knee. Next we will move on to question number 93. Which of the following vaccines are included in National Immunization Schedule except? Here from the option 1 is the except means not included in the National Immunization Schedule. We will see here options. Option A BCG, option B DPT, option C rabies, option D measles. Here the option C rabies is except included in National Immunization Schedule because we all know BCG, DPT, measles. These all are the communicable disorders. We all of you know regarding immunization schedule when we are giving to vaccine to the children through the immunization schedule only. In that immunization schedule, National Immunization Schedule, we are having BCG, DPT, OPV, measles and also so many vaccines also there. But in the National Immunization Schedule, there is no rabies in the vaccines. So here option C is the except included in the National Immunization Schedule. Next we will move on to question number 94. The maximum development of the brain occurs at which age? Means the development of the brain maximally occurs in which age? Options: option A infancy, option B adolescence, option C school age, option D during womb itself. From the birth to age 5, a child brain develops more than at any other time in life. So the age of child is called as infancy. The brain finishes developing and maturing in the mid-late of 20s. The part of brain behind the forehead called as prefrontal cortex is one of the last parts to mature. This area responsible for skills like planning, prioritizing and making good decisions. Maximum development of brain occurs in infancy. Option A is the correct answer. Next we will move on to question number 95. Which of the following is a cardinal manifestations of Digoxin toxicity to patient diagnosed with heart failure? Here the child is diagnosed with heart failure. The cardinal manifestations of digoxin toxicity to patient. What are the diagnosed with heart failure? We will see here options. Option A respiratory distress, option B extreme bradycardia, option C constipation, option D hypertension. Extreme bradycardia, a cardinal sign of digoxin toxicity, increased intracellular calcium from the poisoning of sodium potassium transporter and AV nodal blockage from the increased vagal tone are primary causes for the digoxin toxicity. So here in this situation we can see the extreme bradycardia, we can see the cardinal manifestations of digoxin toxicity to the patient diagnosed with heart failure. So here in this question option B extreme bradycardia is the correct answer. Next we will move on to question number 96. 96th question. A 3 years old child able to perform which activity from the options except? We will see here option A jump in rope, option B follows verbal orders, option C ride a tricycle, option D roller skates. At the age of 3 years, gross motor development and refinement in eye-hand coordination enable a child to ride a tricycle. So here the 3 years child can able to perform jump in rope, follows verbal orders and roller skates they can do, but here the except activity the 3 years child cannot do. Here ride a tricycle. Next we will move on to question number 97. While examining a 2 years old child, the anterior fontanelle is opened. What is the nurse role? Here through the examination of 2 years child, the anterior fontanelle is opened. The nurse assessed during the assessment of the child. Next immediately the nurse what they have to do? We will see here options. Option A, ask about family history. Option B, look for other fontanelles. Option C, inform to the doctor. Option D, none of the above. The anterior fontanella normally closes between the age of 12 and 18 months. The nurse should inform immediately to the doctor and inform about the findings also. The fontanelle can enlarge in the first few months of life and the median age of closure is 13 to 18 months. It will be closed. By the 3 months of age, the anterior fontanella is closed and 1% of infant by the 12 months it will be closed 38%. By the 24 months of closed in 96 to 98 percentage, it will be closed at 28 months. Till the 28 months they have to close the anterior fontanella. But here the anterior fontanella opened. The nurse have to do here inform to the doctor. Here option C is the correct answer. Here immediately she had to inform doctor about the anterior fontanella is opened. Next we will move on to question number 98. A child with rheumatic fever admitted in pediatric unit. When collecting the child history, the nurse should be gather history of about. Here the child is having rheumatic fever, admitted in pediatric unit. While collecting the child history, nurse should have gathered history about. We will see here options. Option A, vomitings. Option B, pharyngitis. Option C, intake and output. Option D, fever. Here the nurse have to gather history about recent episodes of pharyngitis is the most important factor establishing the diagnosis of rheumatic fever. Activation of the innate immune system begins with pharyngeal infection and that leads to presentation of Staphylococcus pyogenes and antigens T and B cells. CD4 plus T cells are activated and production of specific immunoglobulin G and immunoglobulin M antibodies by B cells. So here the nurse had to collect history of pharyngitis, recent episodes of cold and any respiratory tract infection related to the condition. She had to collect the history. From the option B is the correct answer here. Next we will move on to question number 99. Which cranial nerve is not affected in Werdnig-Hoffmann disease? Which of the cranial nerve not included into the disease of Werdnig-Hoffmann? We will see here options. Option A, third cranial nerve. Option B, fourth cranial nerve. Option C, fifth cranial nerve. Option D, all of the above. Here what is Werdnig-Hoffmann disease we have to know. Werdnig-Hoffmann disease is a type of spinal muscular atrophy, SMA, spinal muscular atrophy, a rare form of motor neuron disease. It is the most common type of spinal muscular atrophy and accounts about 80% of individuals with this condition. Here the cranial nerve is not affected. Werdnig-Hoffmann disease is option A, third cranial nerve is not included here in the Werdnig-Hoffmann disease. But here what is fourth cranial nerve, what is fifth cranial nerve we have to know. We are having 12 cranial nerves. In the third cranial nerve is oculomotor nerve, but here options third cranial nerve is except not affected. Here Werdnig-Hoffmann disease means here fourth cranial nerve and fifth cranial nerve is affected to the Werdnig-Hoffmann syndrome. What is fourth cranial nerve? What is fifth cranial nerve? Fourth cranial nerve is trochlear nerve. Fifth cranial nerve is trigeminal nerve. So here in these options, option A is the correct answer here. Next we will move on to question number 100. This is the last question in this video. Percentage of polio infection which are asymptomatic. How much percentage of polio infection is asymptomatic? We will see here options. Option A 20 to 30%. Option B 90 to 95%. Option C 60%. Option D 50%. Approximately 70% of all polio infections in children are asymptomatic. Infected individuals without symptoms shed the virus in nasopharyngeal secretions and stool for several days or weeks, are able to transmit the virus to others. The majority of poliovirus infections are asymptomatic. Up to 70% of infected individuals experience no symptoms and about 25% experience mild symptoms. Paralytic poliomyelitis occurs less than 1% of all infections. But here approximately 70% of all infections in children are asymptomatic. But here not in children, not in adults. The percentage of polio infection which are asymptomatic means altogether ages is 90 to 95% of asymptomatic of polio infection. So here option B is the correct answer here. This is the last question in this video. We are discussing related to the child health nursing point of view 100 questions successfully. In part 1, part 2, part 3 I will give a link in description. Just check it once friends. Thank you so much for watching my video. Please anybody watching first time my channel, subscribe my channel, give a like and share your opinion in comment section. Share the video to your friends. Thank you. Stay tuned.